Hello, everybody, and welcome back to another Live at Mid-City Beat. And here I'm very happy to have again Dr. Fani Rubio. Hi, Dr. Rubio.
Hi, everybody. Thank you for the invitation today.
Yes, this is I think the third time I've had you on a Mid-City Beat live since
Yes, I'm
the
so
pandemic.
excited.
Yeah, so Fanny's been my total hookup for the inside scoop on what's going on with COVID. As pretty much everybody knows, hopefully, and just actually, just before I forget, I do have the comments on. So if you have a question, put it in the comments, and I'll try to see it and get to it. So make sure you chime in if you have a question. But yeah, so I've been doing the medical COVID updates, trying to keep up to date on what the numbers are, what's going on. And Fanny's been a great help. I have been calling her every week almost. And Fanny, what's really going on, right? And so she's been gracious enough to take the time to kind of give me some of the inside scoop so that I can get that information to you guys. So how I want to, well, of course, we're here to talk to Fanny about what the real situation is going on with COVID. I just want to also remind everybody before we get started that at Mid-City Beat, we're pinning to the very top of the feed every Tuesday and Saturday for the most part. Those are my days where I pin up the latest numbers. And so now I'm comparing the numbers with 3 to 4 days before. So you kind of see, instead of every day, the comparison to a few days before. So the numbers are going up. They might be a little bit higher than before, and we're going to talk a little bit about that with Fanny. But I just did load it up, and I'm going to share my screen, and Fanny can kind of help us. Hold on, she can kind of help us take a look at some of these numbers here. Let's see, can we? I don't know if you can see that, Fanny. Can you see that? Okay. So in the last 4 days, there have been 517 new confirmed cases in Yucatan. And then in the last 4 days, there have been 895 suspected cases. And deaths, there have been 27 deaths in 4 days and 172 hospitalizations. So these are the numbers that I always get off of the government of Yucatan sites. Between the government of Yucatan and Mauricio Vila are my sources there. So Fanny, tell us a little bit about your take on what is going on right now with COVID.
Well, right now we're still having cases, and the thing is that also we are having like the normal illness that we always have. So the patients are getting complicated right now because most of the people with hypertension, diabetes, they're not doing their normal checkups monthly. So they're not having a good follow-up in this procedure. So normally when they get the COVID, they get a little bit complicated. So most of the cases are still mild cases, where there is that saying that there are no so severe cases, but we still having COVID infection and those kind of things. So right now they're restricting a little bit about the testing on the normal people. I mean, the government is like a little bit trying to avoid the numbers and declare the numbers. And the suspect cases are very high numbers every day because we're having a lot of cases of different disease of the respiratory tract. Actually, right now I'm seeing an increase in the respiratory tract consultations every day, and that's a little bit weird because it's supposed we are saying to the people, wash your hands, use your mask. That should be not something very frequent, because if the people are actually doing those kind of take cares that is normally for the hygiene for everybody, that should not be do very frequently. So something is not good. I mean, we're saying to the people that use masks and try to use antibacterial gel and wash your hands, but they're not following all the instructions, are not doing it properly. But this season is going to be very complicated because we are starting to be in autumn and very soon in winter, and our winter is not so cold, but even with that situation makes like very many factors that came up together and that promote the illness of the respiratory tract. So that's very, very common.
So do you think that can you tell us a little bit about this again, between the confirmed numbers and the suspected numbers? The confirmed numbers, and I know that's obviously the confirmed, they've taken the COVID-19 test.
Yes.
So tell us a little bit about the difference between these two, and what's going on with the testing of COVID.
Okay, so about the confirmed case is a case that we know that they have the PCR test with the COVID positive.
Right.
That's like a real case that we know they have COVID. And the suspect case is somebody with um, an infection or some symptoms that are related to COVID, but we don't know if they have the COVID or not. They still have to know, we need to test the person and know if they have the connection to have really the illness, okay? So that's why we need to do the PCR test. And when that happens and the PCR test is positive, we know that that case, it's a case of COVID. So we count it right that, okay? So it's very important that for the government to really have the number up, we need to really have like the possibility to do the epidemiological case. With this, that is a procedure for the government to have this person, they have these connections, and they have this contamination with some other people that get infected of COVID. So that's why we know that we track people and we know how they're contaminated and how the virus is going to the population, okay?
Right.
So right now we're going to enter in a new place because right now they talking, I mean, the epidemiological doctors are saying that right now we going to pass to the syndemic, because that name of syndemic talks about two pandemics at the same time. So that's why right now we're entering into the flu season. So the flu season and the COVID at the same time, they're going to do some kind of things, and we need to be like prepared for that kind of things. And
so I have a quick question going back to just the confirmed cases, because I know that before the government was saying nationally they are testing only 10% of the people that they suspect have COVID.
Yeah.
And in Yucatan, they were saying, well, here we're testing 20%. So even if they're testing 20% of suspected cases, that gives us a pretty low rate of what's a true, what the true reality is of how many real confirmed cases we have in the state. So what would you say? What would you say is your opinion, your educated opinion on this confirmed cases? Do you think that they are a lot higher, really, than they appear to be in the official numbers?
Yes, there are a lot of higher that we are seeing in official numbers. Actually, a month ago, the federal government sent a new strategy about how it's going to count the cases, because obviously they're not counted properly, and we are seeing a mathematical, this scam is not correct. So we're seeing that there are even more people getting infected, and we're not knowing exactly, because the number is not something for alarm people. It's something that we need to do to make a strategy in our population. I mean, how many people is getting sick exactly? And these people, what is they doing? And they still working? Because it's probable that if we can contain properly the cases, we're still going to get people sick. And the problem is that for survivance, it's probable that the human race needs to pass through this process, because this illness is new and we need to really make the process to get the antibody and help us to make the defenses to control the illness, okay, for a survival thing, you know?
Right.
But the vulnerable people, I mean, we have a big population of vulnerable people that they are sick, and they maybe if they get contaminated, it's possible they don't going to survive, okay? But we can't do it because that's a probability of chances. We have some kind of process and probabilities to know if there's somebody is going to be good or not in the process. But it's very important that the people they have high risk keep on themselves and try to be good, you know?
Yeah, keep them. So, and one question, because the numbers in the hospitals have really gone down. I know, you know, in June, July, it was really kind of getting scary for all the medical professionals and of course all of us too. So, why do you think it seems like there are still a lot of people getting COVID, but not as many people that are so sick and overwhelming the hospital? Do you think that that is because the medical professionals are getting a better handle on the virus and they're able to, and people are reacting to medications better? Or what is your take on that for the reasons?
Yeah, one of the factors is because we know a little bit more what to expect on the virus and also the natural history of the illness. That's important to know when is the time when they get complicated. Okay.
Right.
One of the messages that I want to say to the people is that right now people take medication like crazy. They get COVID, they start ivermectin, hydroxychloroquine, they take everything. And please don't do that. I mean, that's a very bad decision. If you get COVID, please avoid that your body gets over on medications because that's not good for nobody. I mean, your medication gets like wasted trying to put some chemicals inside, things that they don't going to really affect the perspective of the illness, and in some point having many medications that doesn't work for the illness, because right now we don't have treatment. I mean, we don't have treatment for the COVID. We only give support treatment that helps with the symptoms and with the things that came up with the illness, but we have no specific treatment. So avoid taking ivermectin as azithromycin if you don't need it, okay? That's
Right.
why it's important to keep out from the medication so your body can respond to the virus. And yes, it's true that we are seeing low hospital rates because we have more manageable idea what to do with the patients. But right now with these things of the gamma rays and the delta,
The
we,
flood.
yeah, we are hoping that this is going to change a little bit about the numbers, okay? And that,
You're expecting that to change.
yeah,
Yeah.
yeah, actually, we're seeing people that they're having illnesses that are related to the flooding and the rains, that are some aging illnesses that we didn't see before. But yes, it's very important that we be careful about those details. And yes, it's going to be higher. Mm-hmm.
Right. Yeah, and we see your comment, JL Mac. Yes, yeah, he was saying he believes it's 10 times higher the numbers. Yeah, and that, like what we were saying, or and Dr. Rubio was saying, and really the government of Yucatan, that they're only testing 10%, 10 to 20%. So that really automatically takes it to the numbers of confirmed COVID being probably a lot higher. So yeah, I definitely, if you're high risk, like Dr. Rubio just says, continue to self-isolate and take all the precautions. And yeah, and if you're not high risk, make sure that we're protecting all the high risk people and staying away. And we're doing our part as well with masks and washing and all of that. So yeah. So Fani, what else? What other sorts of messages do you want to get out? You're kind of on hold, expecting an increase in hospitalizations, even in numbers of COVID. So what advice do you have for us who are now starting to get out a little bit more? We're, even to be honest, let's be honest, we're starting to maybe hopefully not let our guard down, but it's been a long time. It's been 7 months, and it's exhausting not seeing and not going out or not having social, and sometimes, sometimes I'm out, and or I've even left the door and been half a block down and I forget my mask. I'm like, oh my gosh. And then it's like one of those moments where you have a dream and you're walking around naked and you're like, oh my God. But, so what is your advice on how we should continue with this in Yucatan?
Well, one of the principal learnings from this illness, I presume, it's like we must be patient. That's the thing. I mean, patience is one of the virtues that will teach us this pandemic. Why? Because it's very difficult. Why is it so difficult? Because we are just so used to the technology that we have everything in this moment and we don't have to wait anything. If you want it, you have it. That's the teaching that we have. And right now with the pandemic, everything is slowed down and we're not having everything that we want. there are people who are family business. They have to shut down because they contaminated with COVID, and they have to wait 2 weeks until they finish with the pandemic, and that affects their economy. And they get so nervous because they feel in some symptoms and they don't know if they're going to be complicated or not. And people that want to go out, and they have birthday parties, they have weddings suspended, graduation parties. I mean, everything is suspended. So yes, I mean, it's like a price that you have to pay for trying to be safe. You keep yourself safe. And maybe people that they're watching, I mean, I have a family loss because of the COVID, and I know what that thing is surreal, and it's been materialized for me, and it's a reality. And
Right.
it's still going to be a reality, I think, for 1 or 2 years, maybe.
Right.
Because some of the people are saying, yes, we're hoping that the vaccine will be in February in Mexico, so yes, we're going to do our normal life. But that's not a guarantee, because even the vaccine is not ready. I mean, the vaccine is something that the researchers trying to do, but normally a vaccine takes at least 3 or 5 years to get like ready, and we can see all the different kind of side effects that we causing or reacting. And right now they making so fast the vaccine that we are not giving all the times to the process, so we don't know what to wait. Okay.
Right.
Yeah. So
Okay, I have just real quick, Dr. Rubio. We have a question from Dave here. He says he will have the snowbirds coming down, especially to the beach. We will have the snowbirds coming down, especially to the beach. Should they voluntarily self-isolate for 2 weeks when they arrive?
yes, I think that the recommendation is yes, they should self isolate for 2 weeks when they come, because they will be exposed in the airport. So I think 1 month ago, a researcher from Lancet magazine, they realized how was the rate of contamination in their airplane, and they were explaining about the flows of the airplane and everything. So the contamination through the to the process of the voyage is not in the plane; it's mostly on the airport. So that's the process when you get exposed to the most risk of get the COVID. So yes, the people that are coming, I should recommend them to have 2 weeks waiting until they go to their normal routines. Yes.
Okay. And we have another question from Linda. So how do you know when you are well and not able to spread the virus? You may be feeling good, but you could still be carrying the virus. How does this work?
Yeah, that's a good question, because, for example, the PCR test that we do, it's check the DNA of the virus in your blood, okay, in your system. We do that to check if we are still get contamination to others. So that's why it's recommended that if you get COVID, the first thing that you have to do, it's a PCR test to be checked if you are affirmative, if you're positive. And then when you finish like 2 weeks after when you did the first one, you do another one to check if you're negative. Because if you're negative PCR test, then says that you are free, you're not contaminated anybody, so you can go and relax yourself a little bit, to not too stressful to contaminate someone else. So yes, that's the indication.
Okay. Okay. Um, so let's say, so I think, what about some last comments, Fanny, before we kind of wrap things up here?
Yes, I want to comment something very important, because right now there's some kind of problems about the flu shot, and I want to express a little things about that, because we have a severe problem right now. This year, the government, I mean the federal government, they don't allow to the privates to sell the flu shot. They only want to get to the flu shot on the government. The problem with the government is normally we have like three pharmaceutical companies. They sell to the private the vaccine of a flu shot. I mean the flu vaccine. And this year, one of the companies, and they decide to not doing flu vaccine, so they just going to sell things for COVID and that kind of brand. So the other two companies, they didn't realize that this third company won't be selling flu shots, so they didn't do any overproduction of the flu shots. So the flu shots right now are very restricted, at least for us, you know.
Okay.
So yeah, the government of Mexico, for example, they buy for the state of Mexico City like 3,000 vaccines for billions of people living in the Mexico City. So that's terrible. I mean, you're not even vaccinating the 10% of your population. And the terrible part is they bought vaccine from India and China and not from good pharmaceutical companies. So that's the kind of problem there because we're not seeing what kind of vaccine they're applying. Okay, so what
So
quality?
what would you suggest? Are you kind of telling people to be careful with the flu shot, or what would you suggest? Because I know a lot of people do want to get the flu shot this year. I've been seeing a lot of that on social media and the expat groups and things. What would you
Yeah.
suggest?
Well, the first thing actually this last week, there was a advertising for the coffee breeze, which is a kind of security medication, like the FDA in the USA, something like that. And they were saying that they were selling in the private um, vaccine, flu vaccine, that it was not original. You know what it means? I mean, they were
But it sounds
selling. Yeah, that's terrible because they're selling vaccine that is not real. I mean, it's not good quality because right now people are so stressed about vaccinate them. They want to get the vaccine, the flu vaccine. I had hundreds of messages on my phone every day asking me about if I have the vaccine, if I could apply it. I mean, normally every year I do, but this year it's going to be very complicated. And I want to say to people that yes, if you have IMSS, if you have like the public services,
service.
yeah, you have to be careful because we not sure very much where they given the vaccine. If you're sure that the vaccine is from Sanofi Pasteur, I mean a good company, okay, you can have that vaccine. But
So what would you say? Would you ask, okay, what is the company this vaccine is coming from? Do you think that
yeah,
people will be able to get that? Really?
you should check that. It's very important and to check that what quality of vaccine because the reason that we want to vaccine people is that we right now with the COVID and the flu, if the person gets something, we don't know what is going on. So if the person is vaccinated for flu, I mean the high probability is they get COVID.
Right.
And yeah, and we already have one case of COVID and flu, so get together, they're even worse. So that's why the importance of the vaccination of the flu. But if you're seeing right now that somebody of the private hospitals is saying, yes, we have the flu shot, that's not true. Nobody in the private hospitals or nobody in the private departments have the flu shot right now because the government has not released the vaccine. Only the government and the public departments have the vaccine. So if you want to get the vaccine, I mean, it's okay. Actually, I want to suggest for the snowbirds who are going to come, before you came, please get your flu shot on the US or in Canada because we don't have right now enough vaccines for everybody. Because
Okay.
when they release the vaccine, there's so many people they want it. So it's going to be like complicated to get
And
the
it's only going through the public system. So we're talking EAMS or Social Security.
Yes, but the thing is, we're hoping that they're going to release at least in November the vaccine for the privates, so the
Okay.
people they want the vaccine they could pay it and we can apply them the vaccine. Okay.
So I guess the message to take from this is just don't rush. People here in Mexico and Merida, especially, don't rush to go get the flu vaccine. Make sure you're getting it from a quality source. So maybe,
Exactly.
yeah, just be sure and be very communicative with your doctor. And,
Mm-hmm.
okay. I,
Yes.
there's a couple more questions here that we haven't gotten to. Melody says, it seems more often people are claiming their symptoms are milder than most people experienced at the beginning of the year. Do you feel the virus is weakening?
Well, no. The thing is that we have like 6 types of serotypes. That means like 6 different virus types. And some of them are mild and not so severe, and the other types are more severe. So depending on the serotype that you get, it's a little bit about the symptoms, and also depends what other environmental factors, like if you get treatment on time, if the person has well um, a good diet, because there's so many people that are not eating properly. I mean, right now they're eating like there's this fashion thing about eating like proteins in a bucket and things in the bucket and nothing from the nature. People is not eating. And it's not the same thing that you buy an orange and you take the orange and you eat that you buy the juice from the Florida's forever and you buy that. It's not the same thing, okay? So
Right.
yes, we need to, that depends on the diet, depends on the complications that the person already has. I mean, if they have any illness or chronic diseases, and also depending on the follow-up with the doctor. That
Right.
makes a difference on the prognosis. I mean, what if you're getting the good treatment on time and the patient have to take care of herself and not be exposing them to environmental that could be a risk for them? Because one of the things that get complicated with the patients is that they get infected with some bacterial or viral infection that gets complicated on the body. So yes.
So they have COVID, but then they get also something else
Yeah.
because they're exposed to some other bacteria. Okay.
Yes.
Okay, and I also have another question. JL Max says, if we are all wearing masks to protect COVID, what would the mask not keep us safe from the flu to the regular?
Well, that's a good question, because the masks are different. There's so many masks on the market, and there are some people who are doing the cloth mask, and some kind of designs of the cloth mask is good, but in some points there are others that are not good. So that kind of things makes the difference on the efficiency of the mask.
Yeah.
Because you can wear a mask, but if it's not a good mask, it's not going to help you and protect you. So that's the little
Whether COVID or the flu.
exactly, yes, because
But if you have a pretty good mask, will you be pretty safe from the flu and COVID? I mean, kind of the same
yeah.
safety.
Yes, more safety. But the other detail are the contamination through the things. Because, for example, people use their mask and they overuse their mask again. So they wear the mask and they take it off and they put it wherever they want. And that's some contamination for their mask. And when you're going to use it again and you put it, you already contaminate your mask. So that kind of details, it's very important. Also, the contamination through the objects, okay, like the phones, for example,
Yeah.
or yes, that's the other things, because the phone, it's very dangerous because it's everywhere, and people is not so used to clean their phones. So that's another place that is contamination to fomites, that we call that. The contamination to fomites, it's some object that is in contact with the virus, that it has the virus, so you are not wearing your mask, you grab that object, you go to your face, and you get contaminated. So
Right. Yeah, that's one thing I always try to make it a habit to clean the phone as soon as you get in, because that's something to always try to get in the habit of doing, because yeah, you're touching, you just sanitize your hands and then you touch with sanitize, right?
yeah.
All right. So, okay. But yeah, so JL says, but if you're doing everything right, will my mask protect both?
Exactly. Yes.
Yes. It will.
Yes.
Well, let's go ahead and finish up. If you have any last things, just kind of wrapping up, kind of a little summary of what Fani said. The numbers are controlled for the most part now, but we are seeing more and more people confirmed every day, and they are looking at they're expecting, let's say, the numbers to go up from the storms that we had and the situation that people had to be living in. A lot of people are still living in water, so we're going to have to be very vigilant over the next couple of weeks. And the flu, and then the other thing that was very interesting today about the flu shot. So make sure you know where, if you do decide to get the flu shot, where you are getting that flu shot. So make sure that you're talking to your doctor about the origin of the flu shot. So any last comments, Dr.?
Yeah, I want to do 2 comments. Please eat well. take care of your diets, please. Don't be, yes, because right now we're seeing so many food disorders because people is in their houses and they're eating whatever and they waiting more, and that's not good. Okay, we can do some strategies to things to do on the house, that we can do some activities and work out inside. Okay, or maybe in the background in a small park nearby, because we also have to take care of our mental health too, because we need to be like peaceful and calm. And if you like some meditation, you can meditate, and there is some kind of alternatives that we can do. We have to keep us healthier. Okay.
Sure.
Yes, and be careful about the parties. I know that you want to gather in together, but bars, restaurants are like very dangerous yet, because some of them they're not have like all the hygiene process, and it's like they are wanting to work because they need the money, but yes, it's a risk for yourself. Okay.
Right. Yeah. Yeah. So
Okay.
we just continue to be vigilant.
Yes, and
Vitamin C, right?
yes, and take
C.
vitamin C and D and zinc. Yes, that's important. And they just asked me a question right now, and I want to reply it.
Okay.
Yeah, the good vaccine is the Sanofi Pasteur. Okay, the Fluzone. That's the name of the vaccine.
Okay, hold
Okay.
on. I'll put it up here. Let me put it in the banner. Okay, how do you spell that? I didn't get that.
Yes.
Can you tell me that again, and I'll write it in the banner.
FL is Fluzone.
FLO or
Flu-
FLUSONI Y.
I.
I. Okay, let's see if I got that right, and you can tell me if that's right. Flusoni, like this?
No, Fluzone E, like E. The last one is E. Fluzone.
With an E at the end. Okay, so this is the vaccine for flu, like the. Okay, so let's try that. Like this?
Yeah. Okay. Yes.
This is the good brand of vaccine. Yeah?
Yes.
Flusoni.
Yes.
All right.
Okay. Yes, and yeah, well, that will be like the that's the summary. And yes, keep yourself, protect yourself. I mean, and also be careful of the sanitizers, because some people have problems in their hands and also in their eyes,
Yeah.
because of the problem they're using sanitizers that are not so good for the skin.
Sure.
And yeah, it's not like friendly for the skin, and they have so many dermatitis. So no over sanitize also, and use good sanitizers. Yeah.
Soap and water is probably the best.
Yeah. That will be the best.
Yeah. Well, okay. Well, thanks so much again, Dr. Rubio, and I will be in touch, as you know.
Okay, well, take care. And
For
thank you
help
so
and
much.
all your information. And we're going to hope that all the doctors aren't overwhelmed in the hospitals, and that the people are safe after the floods, and we can keep this under wraps. So,
Okay.
thanks for joining in, you guys. We'll see you soon.
Okay, bye-bye.